In this short video, we're going to look at how you can convert more patients into paying clients. And this is done with a step-by-step guide to identifying the patient with empathy who might be interested and suitable for Simple Orthodontics. Now, what we do know is the Western world average is around 25 to 35% of your existing and new patients are unhappy in some shape or form with their smile. And what we need to try and do is identify those patients. There's two ways in which we can do this. You can have a general discussion with them and ask them how they feel. Obviously, some people are not comfortable with this. And if that's the case, we suggest you do it in the form of a survey, which is really easy. And you can explain to the patient that you want to undertake this survey. It's going to take them about 10 seconds just to fill it in and to improve your services to the patients. Now, what we're really interested in question number 2, and it's written specifically to give you the answers that you need. So how would you rate the shape, shade and position of your teeth out of 10? So they're going to give you a number, a rating, and if it's not 10, then you've got potential of doing some work for them. What don't you like about the smile? So in other words, they ask them to tell them exactly what's wrong with the wonky teeth or yellow teeth. And if there's something you can do to get you closer to 10, would you be interested in? Now what this does is opens up the door for you to have a discussion with the patient. So when the patient comes in to see you, they sit down in your chair, you can thank them for completing the survey, and then you can refer back to question 2 and ask them more about it. Acknowledge what they've said with empathy. I understand how that might make you feel. Ask them to explain about their problems and their concerns. And if it's appropriate for Simple Orthodontics, then introduce them to it and to QST and suggest that they might be suitable. Now, at this point in time, they're going to be thinking, oh, orthodontics, okay, that's really expensive and it's time-consuming, it's going to take years, and it's ugly Betty braces, as we like to call them. So what you've got to do as a dentist is try and dispel these 3 myths. There's 2 ways of really doing this very, very effectively. Firstly, demonstrate. Let them hold, feel and see the near invisible 3M Gemini brackets. Remember, they're thinking clunky braces, jaws type braces. Try holding the typodont, a couple of meters away from them, and ask if they can see the brackets and the tooth coloured wire. I've tried it, you actually can't. So now they're recognising that, oh, actually, this is all right. It looks quite attractive, actually. But what you then need to do is demonstrate what results can be achieved in a short space of time. So show them suitable before and after pictures, taken from our website. Alternatively, if you've already completed some cases, show them some that you've done. It's even more important. At this stage, if they're interested, what you can suggest to them is, well, we'll just take some intraoral photographs. You can do it yourself, or your nurse can do it, and then upload them to the forum for assessments and to check suitability. Once that's been approved by the forum, you can then call the patient back and explain in detail what the specialists have advised. It's going to take 3 months or 4 months or 7 months. And if the patient's happy, get them to sign the consent form, take impressions, complete the online lab docket, pay for the case of course, and send to the lab. Now, if the patient says no or not yet, remember, not everybody is born with a perfect smile, and this is an emotional problem. It's not a painful thing. It's a problem that's not going to go away until you fix it. So at their next checkup, why not readdress the situation, reinforce their concerns and ask them how do they feel, and ask them, is this a suitable time to try and resolve their problem? So as a recap, 4 steps to high conversions. Identify the patients, empathise with them, demonstrate and confirm. And with good luck, you should see your conversion rate skyrocket.